The University of Melbourne and Breakthrough Victoria came together to set up the University of Melbourne Genesis Pre-Seed Fund. The objective was to help great founders, academics, clinicians, students to take their research and invention to get them out of the university into startup companies and get them on their way. Over the past 12 months, the investment team have led the work up and subsequent investment into 6 startup companies, and here they are.
Our everyday lives are impacted by nanotechnology in ways we can't imagine. Our company makes microscopy products that provide researchers and people in industry a way to see tiny particles fast, easily, without complicated sample preparation. For everyone to be able to see the nano world on a scale that's much more accessible, we think can change a lot of things.
So what Carly Healthcare are developing is a wearable device and digital health platform for pregnancy monitoring. Essentially, all that information about the mum and the baby is being relayed to her smartphone, back to a cloud system where the doctor can view it in real time.
The remote communities and people who are disadvantaged, they don't have access. Because of the internet connections and the cloud computing facilities available, you still have continuous care. You don't have to be physically present.
I can really see where this device might be able to help us improve outcomes in order to guide clinical management.
80% of clinical trials currently fail to recruit on time or recruit at all. And that's why Torch Recruit was developed, to identify patients out in the community that might be eligible to participate in clinical trials. So we've developed software where we take patient inclusion and exclusion criteria for trials, turn those into code and run them over the electronic medical records of patients. Within seconds, generate lists of patients that might be interested in participating in trials, helping potentially thousands of people to get access to new therapies.
50 million people with epilepsy in the world. The average patients are in their sort of teens when they're diagnosed with epilepsy. By the time they get to finally deciding the surgery is the right option, they're in their 30s. So you're building a solution for epilepsy patients, which is an electrode technology that goes into the cortex of the brain, down at the single neuron level to monitor and record the state of their brain that predicts whether they may or may not have a seizure. And then we can use a stimulator to get on top of their epilepsy.
If we can give people a degree of certainty, then people can start to work again, look after their kids, go for a swim, even maybe drive a car.
Every Australian is affected by poor air quality. 1 in 5 Australians have hay fever and about 1 in 9 Australians have asthma. Melbourne Pollen provide forecasts for everything that's in the air through an app, and that app provides information about pollen, air quality, smoke and wood fire smoke. We also help government. We're integrated in Victoria's emergency response, and now we're able to take that next step and make the service even better. And this funding is really going to make that possible.
There are 240,000 children born every year who have got severe to profound deafness. Do they need a hearing aid, or do they need, for instance, a cochlear implant?
The whole purpose of NIRGenie is to fast-track early intervention for babies with hearing loss.
NIRGenie is a diagnostic tool for paediatric audiology, basically shining light into the brain. From there you can determine whether there's a change in the oxygenation level of the blood.
What we're trying to do is give every baby the best opportunity that they can possibly have to actually develop spoken language well.